Medical students and doctors waste their valuable time in the clinical exam purely by reading the scenario wrong. The solution to this is by using action words. Let me give you an example. A 40-year-old man has come to you with chest pain. You are a doctor in the emergency department. Your task is to take history and explain the differentials to the patient. Most of the doctors or medical students read the scenario wrong. Instead of taking history and explaining the differentials to the patient, they do something else. So, this is where you actually have to have a step by step approach or a structured approach that will help you save time and pass your clinical exam. I use something called action words. These are the words I look for in the scenario, so I don't miss anything important. For example, a 40-year-old man has come with chest pain. 40-year-old man, chest pain. You are an intern in the emergency department. Intern and emergency department. These are all action words. Then you look for words. Is it asking you about explaining the diagnosis? Is it taking history? Is it about asking the examiner for findings? Or is it examining the cardiovascular system of the patient? So look for the key words in the scenario. That way, what to do when you enter the room and when you talk to the patient, you remember the things. So make sure you look for action words. This video is part of my OSCE Mastery Coaching System. If you would like to know about the full system, look for a link in the bio or under this video and you will get to know about the OSCE Mastery Coaching System where you will learn the clinical skills to pass your clinical exams and be a successful clinician.